Hi, I'm Russ Durstein. This is another congressional conversation with Concerned Veterans for America. And it's my pleasure to have Congresswoman Miller-Meeks with us today. I understand you have a rich military background, not only your family, but you served as well. You want to tell us a little bit about that?
Sure. So I enlisted in the Army when I was 18, when I got my degree in nursing. So I was going to school working full-time. When I got my degree in nursing, I became a butter bar lieutenant stationed at Walter Reed here in Washington, D.C., which is where I met my husband, who was an E6 licensed practical nurse. And eventually I roped him into marrying me. And so I ended up spending 24 years in the military, active duty and reserve. My husband, 30 years. My father was career Air Force. 6 of the 8 children in my family served in the military. I think the only branch we haven't served in is the Coast Guard.
Oh, that's an amazing story. I know the Iowa 1st, in which you serve, has over 42,000 veterans in it. How has that background kind of helped you with linking, common knowledge and overlap with the veterans in your district?
Well, certainly having that proportion of veterans within your district would lend one to be very empathetic or engaged with the veterans. But having a veteran background and coming from a military family, you know of the struggles, you know the challenges, you've been there, you've experienced them firsthand, you know how hard it is to be the spouse or the family member of an active duty military member. And it also helps to form your decisions and your policies, and it especially helps inform my decisions and policies when it comes to community care.
Fantastic. And then obviously you're on the Veterans Affairs Committee. What's that like?
So it was one of my top choices for committees. It's not an A committee, but for me it was very important to be on the Veterans Affairs Committee. This is my 2nd term on the committee, and with the Republicans being in the majority, I'm the chair of the Health Subcommittee, which Chairman Bost wanted to have a doctor who is the chair of the Health Subcommittee, so I'm very honored to be the chair of that subcommittee.
It means a lot to veterans to have voices like yours on that committee, so thank you for your service there.
We
appreciate it. Last year you introduced the Veteran Care Improvement Act, or the VCIA, one of CVA's priority bills for 2024. We are very much promoting that and excited to see it. Can you walk us through some of the key pieces and why you introduced it?
Yeah, I think something that's very important to individuals, we know that over the past 2 decades there's been increasing emphasis and oversight on care that the VA delivers. So you have some VA hospitals that deliver phenomenal care. I've got one of those in my own district at Iowa City, the Iowa City VA. But then you have others that have very long waiting periods, and that's why another doctor who chaired the Health Subcommittee and chaired the Veterans Committee, Dr. Phil Rowe, introduced and got passed the Mission Act. So if you'll recall, about a decade ago, we had veterans who were dying on waiting lists. They couldn't get care. They couldn't complete care once it was started. So there was a lack of continuity of care. And so the Mission Act was implemented. And the purpose of the Mission Act was to allow veterans, if they could not get into a VA facility, that they could get care within their community. And I think one of the most important things to realize, if you look back in history, the majority of our military strength was made up of active duty individuals. Probably in your time it was that way. One of the Cold War dividends or peace dividends was that we wouldn't have a large active duty military strength, but our entire military strength would be made up of active duty and then reserve and then National Guard. And people have already forgotten that President George Bush got in a lot of trouble for activating the National Guard overseas because it hadn't been done before. Now, when half of your military strength is made up of people who come from a community, not a military base, those individuals return to a community. They don't return to a military base, military family, where they have access to services and mentoring and guidance. They return back to a community where no one there may be able to help them access their benefits or health care. So the Mission Act to me was a very important recognition of what our nation had undergone, the changes in our active duty military strength, and therefore if you're returning to a community, it's important that you have access to care within your community. We don't want to do away with the VA hospitals. There are some things that the VA hospitals do that no other healthcare facility can do to the level and the excellence that they do. But we also know there are other things, mental health care, PTSD treatment, access to routine things that can be done in a community and by community providers.
Congresswoman, I think that's an excellent point. I live in a part of the country that's rural. A lot of veterans come back there to retire. They have to drive great distances. And I think and have long wait times. I think for a veteran to have more than one option, if they have a great facility, that's wonderful. But for some, they don't, and I love how you just described that act. That's really exciting. One part of VCIA, excuse me, are particularly excited about is this provision codifying the access standards for when veterans are eligible to use their healthcare benefits, and use those providers outside of the VA. You want to talk through a little bit about what some of those community care options are and why they're so important?
Yeah, so we had already heard from veterans within our district and in fact across the country. And last night we just had a veterans town hall with Chairman Boss, and we heard the same thing, and that is they couldn't get access to care. They would get a call back from the VA on the 29th day to then delay again the 30-day mark to make their appointment. And so we're hearing this from veterans, but then when you would meet with the VA or the VA staff or undersecretaries or even the secretary, they would deny that those problems or issues existed. We increased pay, we've increased the number of people that they could hire, but nonetheless, these issues and problems still exist. And what was surprising was that we had an oversight hearing in which we found out that the VA did not consider residential mental health care or substance abuse treatment. And I can tell you as a doctor, and as a person who changed state law for pre-authorization when it comes to substance use treatment, it was astounding to me that the VA did not consider those aspects of healthcare. With the rate of suicide we have in veterans, they did not consider those to be under the Mission Act. So they felt no obligation to get a veteran in for residential mental health care or for substance use treatment within 30 days. So notwithstanding the other problems with implementing the Mission Act, it was very clear the Mission Act was not being implemented. There was a bias against having veterans go to community providers, and in essence, veterans were not being treated in the manner that honored the sacrifice they've given to our country.
That is some of the great work that you and your committee has provided that we are probably the most proud of. We want to say thank you for that. That's really important, especially with the suicide rates that so many. My son's a combat veteran, served both in Iraq and Afghanistan. He and his peer group, that's probably one of the most underreported obstacles they face. So thank you for that great hard work. In recent years, the Freedom of Information Act or suit was brought by Americans for Prosperity Foundation and revealed that the VA routinely tries to persuade veterans from calling and asking for community care. What do you think drives that practice inside the VA, and what are the impacts on those that have served our country?
Yeah, I never want to guess what the motivation of people is, and I suspect that it's in order they feel that they give high quality care. I've met with providers and doctors from the VA who give high quality care. They want to be able to treat veterans. They feel that they have a dedication solely to veterans, and therefore, since that's their focus and their priority, that they do a better job. But you can give the most excellent care. But if a veteran can't access that care, it doesn't matter. You're receiving no care at all. And I think when it comes to mental health, residential mental health, substance abuse, when a veteran gets to that point where they seek out that care, that's care that needs to be delivered and delivered immediately. And so it was, for me, a relatively easy thing to do after we had heard testimony, we had talked with veterans, we had heard their complaints. We heard our veteran support advocacy groups testify, and it was in contrast to what the VA was saying. And so it was not a hard thing to do to say, we're going to put parameters for care. You have to be given an appointment, given admission within 10 days for residential mental health care or substance abuse care, and if you're not, then you can receive community care. The VA was also not advising veterans that they could receive care in the community. That was the other issue and the other problem. They wouldn't be given an appointment, they would be called at the 29th day, given another 30 days, or their appointment would be in a visit, meaning a VA hospital. It could be 100, 200, it could be several states away. How is that access to care? And when it's mental health care and suicide prevention and PTSD and substance use, you may need the support of your family members or your peers that are in your veteran community. So it was just unacceptable. And my biggest regret is that we couldn't get our colleagues on the other side of the aisle to support this because they were afraid that it would deter the use of telehealth. And I can assure you, the most important thing is that veterans get the option. If they want an in-person or residential treatment, they're offered the choice. If they wanted a telehealth, they're offered the choice. But when they're in crisis, we need to be there for them.
To have as many tools available as possible, you know, we give GIs the GI Bill, and we let them choose what university meets their needs. We allow them to access VA loans. The veteran is the center of the choice-making process. Here, they may have an excellent choice with excellent VA care, but some don't. And so what you've done is help put as many tools and many options as possible through this act. One of the things that we also were concerned about, the VA took down the Mission Act website. And so educating and informing veterans as to what their options were under community care has been greatly diminished by that.
And I can tell you as a provider, so having taken
been on
care
that
of
side
veterans,
too, yeah.
As a provider, getting them access, getting coverage after it's been approved, and then told it's not going to be paid for. So it's a lack of transparency, a lack of honesty, and honestly, it's a lack of compliance with the law. The law says that a veteran can access care in the community, and therefore the VA should be, you know, serving the veteran and making sure they comply with the law. That's why we have oversight hearings.
That's wonderful. And the education part, do you feel like this Veteran Care Improvement Act would help change that?
I think it'll help change it, but it's also a mindset and a culture. And so we're having to change a culture that is a culture that puts the veteran first and the veteran's access to care first, in addition to having quality care and excellent care. I don't mind having parameters. I don't mind having oversight of community care. I can tell you my veterans, you know, held me to a very high standard. So I'm happy to have that oversight of the VA over community providers. But the most important thing is that veterans have access to care when and where they need it, especially those veterans, as we know, that served in Iraq and Afghanistan, that have come back after multiple deployments, who very desperately need these services.
Well, your hard work has been much appreciated. Would you like, as we close, share a little bit about what constituents in your district can do, who they can reach out to, some of the constituent services you provide? Would you like to share that with?
Well, I certainly would, and there's, you know, there are a variety of services, and I think for us, it's to make sure they know what, you know, what clinics are available, what hospitals are available, how to make appointments, and they can certainly call our office in district in Iowa. They can call our office in Davenport. They can reach Nick. I'm going to have to read the number for you, though. So 563-232-0930. That would reach our office in Davenport, and that can help you with any of the services you need as veterans, or help you get to the people that can answer any questions for you if we can't answer those for you.
Fantastic. That wraps up another version of Congressional Conversations with CVA. A true champion here. It's been my honor and pleasure to get to visit with Congresswoman Miller-Meeks. Thank you for all your hard work. We appreciate it.
My pleasure.